Welcome back to the channel. We're diving into the world of dermarolling and its effectiveness on hair. Many people swear by this technique for hair growth, but does it work? Let's uncover the facts. First, let's understand what actual dermarolling is. So it uses microneedling. So it's a specialized tool called a dermaroller, which consists of tiny needles attached to a roller. By rolling this device over the scalp, it creates micro injuries, stimulating the body's natural healing process. Most of the theories behind dermarolling for hair growth is that the micro injuries trigger the release of growth factors. That's my phone. The theory behind dermarolling for hair growth is that these micro injuries trigger the release of growth factors which increase the blood circulation in the scalp. This in turn is believed to promote hair regrowth and improve the overall health of hair follicles. This can create an environment that supports hair growth and can also, crucially, enhance the absorption of topical hair growth products. So if you look at clinical literature, looking specifically at dermarolling, there are very few that are just with using microneedling alone. There are a few clinical studies that show that it does improve hair growth in androgenic alopecia. So this is female and male pattern hair loss. This is certainly something that a lot of people do at home and have seen to be quite efficacious, so it works well. Most of the clinical studies that I found on my literature search were mixed, so i.e. using microneedling with topical application of a stimulating ingredient. For example, minoxidil. So some people combine the use of it. And there's one specific study that looked at using microneedling alone, showing that it does have benefit, but then comparing it to microneedling and using minoxidil. And the people that were using the dual-based treatment with minoxidil got more of a better result. It's really important that whilst dermarolling can be a promising treatment option, it's important to note that individual results may vary. It's best to consult with a dermatologist before starting any hair loss treatment, including dermarolling, because they can assess your specific conditions and recommend the most suitable approach for you. So one common mistake that I see is patients that are having hair loss of unknown origin, and actually what they have is shock loss. That might be due to vitamin or mineral deficiency, it might be due to stress, for instance, and then they start dermarolling. And if you're dermarolling, you may be causing more of a shock loss, so you may end up having more hair loss. So it's important to get a proper diagnosis first before doing it. Now, let's look at the process of dermarolling for the hair. It's essential to use a clean dermaroller and follow proper hygiene practices to minimize the risk of infections. So here's how it's done. Start with a clean scalp and a sanitized dermaroller. You can use a product called Clinicept, which is fantastic. You can buy it from most pharmacies and you can spray that on the dermaroller, and you can also cleanse your scalp with it. Divide your hair into sections for easier access and gently roll the dermaroller over each section of the scalp, applying light pressure. Don't press too hard. If you press harder, you're not going to get a better result. Roll vertically and horizontally and diagonally to cover the whole scalp. So I normally say that you can spend probably maximum, like you're brushing your teeth, probably about 2 to 3 minutes on this. Afterwards, you can apply a hair growth serum or any topical treatments as recommended by your doctor. One little benefit that I will say to you, which I would stay away from, is putting minoxidil directly on afterwards, because I find that when I use it for my hair loss, it can sometimes sting a little bit afterwards. So I only use minoxidil just once daily, and then I microneedle once daily as well, so AM and PM, and it depends on which time you want to do that. People always ask me about the depth. There's only one clinical study that looked at combining minoxidil and different depths of microneedling, and what they found is that their optimal depth was 0.6 millimeters. So you don't need to go so deep as you think you need to go. So 0.6 millimeters is what you're going to be looking for. In summary, dermarolling for hair growth holds some potential benefits. There are many clinical papers that indicate its improvement for things like androgenic alopecia, so normal female and male pattern hair loss. It may stimulate hair growth, increase blood flow to the scalp, and enhance the absorption of topical hair growth products as well. But as always, it's always important to seek a professional who specializes in hair to perform a scalp analysis beforehand to determine suitability. So that's all for today's video. If you found this information helpful, make sure you like and subscribe, and we'll see you soon.